A patient met with the RTA, brought to the emergency room. The patient have expectorated the blood on the floor. What is the first step in the cleaning? Fine. So guys, whenever we talk about this particular scenario, this question already have came in the one of the exams. And in that, what was there? In this particular one, that our intern is there taking up the blood sample to the lab, and suddenly it get away from the hand and it's fallen on the floor. Okay. So that particular one, what is the first step in this particular one? So as per the protocol, you should always control the spill first. Okay. You should always control the spill first. And then you have to put up 0.5 to 1% sodium hypochlorite. Okay. So you should control the spill first, and then you should put this 0.5 to 1% sodium hypochlorite. And nowadays, this question can also come that how much, like out of this, if they give the options, 0.5 or 1%, which one is better? The answer is 0.5% rather than 1%. 0.5% sodium hypochlorite you have to put there, and you have to wait for some time. And after that particular one, you have to clean up as per the biomedical waste management stuff. Okay. So important is that as per the new protocol, that you should control the spill first. And in a government college, like in a government hospital, that there is a lot of crowd there. So if there is a spill, then might be on that somebody puts a leg and moves up in the whole hospital. So your basic purpose is whenever the spill happens, any healthcare worker can do, that is the nurse or any intern or whatever which they're carrying off, which are there, they can do what? They can put the tissue papers or any absorbent material over that, so that the other ones, they should not be putting up their feet over it and move in the hospital. So first is always the control the spill, and then in a good hospital, we have infection control team nowadays, and those infection control team will be informed of as per the coding system is there now. As per NABH, there is a coding system. They will inform up the infection control team, and that infection control team will put up this 0.5% sodium hypochlorite, better option than 1% sodium hypochlorite. That should be remembered first of all. And you should stay this for some time and then clean up as per the biomedical waste management stuff. Okay. So what is the purpose of this question is that you should not directly put up sodium hypochlorite, and it is not available also everywhere. So obviously it is not available. So first thing from your viewpoint is that you should control the spill, and you should be standing there, seeing up this thing, that nobody is moving up near that particular one. And if at all somebody is moving up, you should tell that be far from here because the spill have happened. Okay. So that is what is the logic. So first of all, you should control the spill, and then you should put 0.5 to 1% sodium hypochlorite on that particular stuff to disinfect that particular one. Is it fine?